It reduces labor costs because you're outsourcing this service, which means you don't have to have your own staff to do it. I'm not saying that you get rid of your own staff, but what I'm saying is that when you think about an RT, if they could manage 50 patients today, well, maybe they can manage 75 or 100 when we come alongside of you. And so what we see is you're going to see a 40-50% reduction in your RT labor costs when you start to scale with us because of the fact that you have, number one, a fixed cost of knowing exactly how much it costs per patient. And then number two, your therapist can do more of the things that are revenue driving, like CPAP setups, and don't have to manage as many patients that we're just maintaining, right? So the whole idea being that if you look at our calculators, then you can plug in some of those numbers to identify how much savings, cost savings you would get from our programs, but also how much new revenue you would get from the opportunity that it creates. So it's a reduction of cost, but also a increase in ROI because of the new revenue that comes from it. So if you think about this, even without the NCD, what we do makes a lot of sense for your business because it drives revenue, reduces cost. With the NCD, it's almost a no-brainer. Why would you not outsource it? Because it's going to be difficult to manage, and you want to be able to make sure that you check all the boxes and you don't get in a position where you can't bill for that service. So from a labor perspective, it's really about looking at, what are your costs? How could you increase the number of patients each RT manages? And by doing that, what's the savings that you obtain? Generally speaking, we, in our telerespiratory call center, we're able to keep costs down because we don't have all the extra overhead. We don't have all the travel time. And just simply because, someplace in the country, respiratory therapists cost a whole lot more than they do other parts of the country. So we're able to keep our costs down, especially when you start thinking about, using our service when you're in California, you're in New York, you're in some of these places that are very, very expensive to staff respiratory therapists. It is a 100% no-brainer. But even in markets where respiratory therapists don't make quite as much, there is a substantial cost savings when you start to scale with our service.